So we want to make sure that they have all the services and programs available to them through also their health insurances, and making sure they would reach their needs. Like for instance, our podiatrist, she's able to help a lot of our diabetes patients, especially with toenail clipping. You got to be very careful clipping their toenails so they're not in care. We're the pioneers in the industry. We set the path for every single primary care. If you look over our model of care,
wasn't the same level. And I had to actually put her back with CareMore because of the differences.
Wow.
So I became aware of how much they did by having my own client experience, and then realizing that, wow, look at all the stuff that they do. And that's how I became familiar with CareMore in the market.
Right. And you want to be able to set your client and walk away from that, so they're not constantly calling you. You want to move on to the next client. There's so many great things that we can do and see them. Like when you think of value-based care, and especially on the West Coast, you're looking at like there's certain groups out there, they performance with their doctors. A lot of them, they get paid more if they see 15 patients within an hour versus a clinic that sees maybe 3 to 5 patients an hour, because you want to make sure that you have that quality of care with our patients, because we have longer times with our patients spent in the rooms, so that we're going to get to know them and build each plan with them, because everyone has different health needs. Any other questions online that they have? And I'll go over that also on a slide. First appointments always to come into CareMore is about up to 1 hour. Your follow-up appointments, so that's called a Healthy Start appointment. That's where they're going to do that head-to-toe assessment. They're gonna ask all those probing questions. Like for instance, we don't think about this. Say I go into a doctor's office, and a lot of times, I had this experience in the past. You wait 4 months to get an appointment. The doctor comes in, shakes your hand for 5 minutes, out the door, and they didn't get to know you. We want to get to know them. So they're going to ask you about your health history 5 years from now, 10 years ago, what's been going on. They want to hear all about your surgeries, your health issues. Follow-up appointments with us, depending on your health needs. I know the Medicare population, they like to sit down with a doctor. They like to discuss stuff versus the social media population. They just want a quick appointment, get in and get out. But we want to make sure your follow-up appointments are always about a half hour to 45 minutes, depending on your health needs. And those are called the Healthy Journey appointments, and then follow-up appointments down the road. So depending on each health needs, but you'll always have that quality of time with our providers in the patient rooms. Always.
If somebody has a critical illness, you guys have advanced targeting processes for those things that other clinics.
Their home. If any of our patients have any mobility issues or clinical issues, and they meet that criteria with our team and also with the health insurance to make sure it's covered, everything we can do in our care center, we can do in their home settings, which is awesome. We can also do appointments by virtual or telephonic. A lot of seniors don't have the technology, so we could do the telephone visits if they can't get into our care centers. But always your first appointment should be in the care center so we can evaluate you. You'll notice around the circle here, we have case management teams. Sometimes we don't think of this. Say mom goes into the doctor's office and they say, Sally, we got to rush you to the hospital. Well, who's communicating that to Sally's husband? Who's communicating that to her son or daughter? It's our teams. Our team's going to reach out to let her loved ones know, mom is being rushed to the hospital. We want to let you know what happened. Say there was something going on and we needed that emergency. Then they know that she's in the hospital. Our case management team will follow up with our patients there and make sure it's a safe discharge. They'll coordinate that care with because a lot of hospitals, and I know this from working in other industries in healthcare, they will discharge you, and they don't care that nobody's at home helping them. Sally lives by herself at home. Who's going to help Sally when she gets home? Is there a home health referral set up?
I just had a guy discharged Wednesday. Yeah. He still has no home health care. Didn't get him a wheelchair or a walker or anything.
Right.
It was horrible.
And the communication gap is there. A lot of folks don't talk to one another. That's why I love the fact that we have a case management team that's always in the know about our patients. They're going to make sure that our safe, say they need to go to rehab and they don't need to go straight home because they don't have that care. They want to make, because with Medicare, I know there's like certain amount of days you can stay in the
Day
hospital.
21 they're
And
out.
a lot of time those discharge, they don't care where you go. They're just going to discharge you. And I know that for a fact because I worked with the hospital case managers before and I've seen it happen. And it's sad. But we want to make sure that we're always in the know with with your clients. We also have a health team that's also involved with our clinics besides the case manager team. So you're going to see here, that we offer programs. So we have the 24/7. Here's another great benefit about CareMore. We have access to our nurse hotline 24/7. I tell everyone, so you can tell your clients, there's no excuse for them not to reach out to us. Say they pick up a prescription. I'm just giving you examples here. You pick up your prescription, you don't take it, say they go to bed at 8 o'clock at night. Well, the clinics are closed and they have a reaction to that medication or they're not sure how to take that medication. Call us. We'll triage that call. We'll educate them. It could be something so simple. Or they're not feeling good and they don't know if they should go to the emergency room. How many times we went to the emergency room in the middle of the night and we sat there for 5 hours in the waiting room. The doctor comes in and it was an unnecessary visit. They get charged and it was a waste of their time. Why not call us? We can save them that trip. If it is a true emergency, we're going to tell you call 911. But a lot of times it could be something so simple where we can have them come into the clinic first thing in the morning because we open up at 8 a.m. But we want our patients to reach out to us. So you can tell your clients, don't reach out to you, reach out to us. Because a lot of time they call you and they're saying, hey, I have a problem with this, or I didn't get a referral or something. Call us. We're always available. Our clinic line, I know our clinic lines close at 5, but we're open until 7 p.m. at night, our clinics. So we have 8 a.m. to 7 p.m. But I want to make sure they know, and they have a dedicated phone number for this 24/7. So they're gonna have that dedicated patient line. And we talked about our mobile team, and I have another slide here. I'll show you some other mobile teams that we work closely with. Any questions on this slide here about our